Hi, my name is Cameron. I'm a student physical therapist. Today we're going to go over some knee tests to see just to test the integrity of the knee. Is it okay if we get started? Perfect. The first thing we're going to do, have the patient in supine. We're going to do knee flexion with overpressure. This is going to test range of motion, any deficits, and see if we have any pain in that. Bring the knee into passive knee flexion and passive range of motion. And then we're going to add a little bit of overpressure. Good. Next, with the patient still on supine, we're going to put a towel underneath the leg. We're going to do knee extension with overpressure. So we're going to place one hand underneath the distal tibia and one at the proximal tibia. We're going to add a little pressure, see if we can get it, and we're going to look for any deficits and pain in extension. Next, we're going to do tibial internal and external rotation. We're going to passively bring the knee into 90 degrees. We're going to stabilize an axilla, or stabilize with the bottom hand. The other hand, we're going to bring the ankle into dorsiflexion, and then we're going to turn into the tibia into internal rotation. We can switch our hands and go into external rotation. With a patient in supine, we can do the Varus test. You can rest the leg on your thigh and brace in your axilla. Bringing your outside leg on the lateral LCO and applying pressure to the medial side of the knee. We would do this at 0 degrees and reproduce it at 30 degrees. Look for any pain and reproduction of symptoms. The patient in supine, we can do the valgus test. We would stabilize the tibia in the axilla, and inside we're going to be stabilized at the MCL, apply pressure on the lateral side of the knee. We would do this at 0 degrees, and then again at 30 degrees, looking for laxity of any ligaments and any reproduction of symptoms. In supine, we can do the anterior drawer test, assessing the integrity of the ACL. We can bring the knee up to 60 to 90 degrees, sitting on the foot. We would reach around to the posterior part of the knee and palpating the anterior part of the tibia, adding anterior force, looking for any laxity in the knee. In supine, we can do the Lachman's test, assessing the integrity of the ACL. We would bring the knee into 20 to 30 degrees. We will stabilize at the distal femur and go behind the posterior tibia and look for any excessive tibial translation, and we would bring anterior force. In supine, we can also do the McMurray's test. We can bring the knee all the way into flexion, palpating the medial lateral joint line. This is going to test for the integrity of the medial lateral meniscus. Internally rotating the tibia and bringing the knee into extension. It's going to test the lateral meniscus, and then bringing the tibia into external rotation and extending the knee is going to test the medial meniscus, and a positive test will be any clicking of the knee. In prone, we can do Apley's test, assessing the medial lateral meniscus. We bring the knee into 90 degrees. We apply load into the knee joint and rotating the tibia externally. See if we can replicate any symptoms or any pain in the knee. Depending on the location of the pain, will give us a positive medial lateral meniscus pathology. With the patient standing, we can do the Thessaly's test. Have the patient place their hands on your shoulders for stabilization. And do not place their hands on their hips, stabilize their pelvis, and on their affected side, we're going to bring the other leg up. We're going to bend the knee at about 20 degrees, and we're going to twist in both directions, testing for the integrity of the medial and lateral meniscus. Relax.